Did you get it, Jenny? Yeah. Okay, sweet. Hey, so I did go down and I did mention it. So fun thing is one of the actual managers that I spoke to, her granddaughter. So it's something that you can tell HR, like if you're feeling uncomfortable. Okay, that's fine. Okay. Is there something that maybe I can send it Kim to be able to say, by the way? The department, don't go north, the department or? Yeah. Not necessarily work the HR, but be that muscle. So where I go down and be like, hey, make sure everyone's wearing a mask. She's like, oh, she's my granddaughter. She's wearing a mask, and the little one runs up without a mask, and she's staying in the office. The employees downstairs will come. Yeah, no, that's also a great spot. HR should always continue to. If I see them tomorrow, I'll tell them.
You print me off the current county list of phone numbers and people. Thanks. Hey, Brett. Hey. Viewing how people catch COVID-19, giving me all the current information. I think I'm okay. I'm not in that. I don't think I'm in a great risk given the places I go, the people I'm with. Thanks, Jenny.
You're welcome.
And the caution I'm utilizing. But it's interesting to read about the science part of this virus and the droplets and the size of the droplets and the way you could catch it based upon being around someone that has it and what the attack rate is. 10% of the people with COVID-19 are responsible for 80% of the transmission. So as long as you avoid that 10%, you're okay.
Just an FYI,
Yeah.
I can hear you.
Huh?
I can hear you.
Yeah, thanks. All right, I won't say anything that I would be ashamed of. Thanks, Jack.
You're welcome.
I'm just trying to stay ahead of the curve here.
don't. Yes,
It's June 17th already.
Mr. Kepler. Hey, David.
Oh, yeah. I already
If you got something sitting.
got you.
You have the,
Hello, Health Department.
Oh, Heidi.
Hey Heidi, how
Hey,
are
good. How are you guys?
Great.
Great. Hi, Ilana. I think we had a response from all board members that they will be here. So I want to give them just a minute or two more to make their way to their computers to get on Zoom.
Hi Heidi, this is John Lim. I'm on the road on my cell phone.
Awesome. Thanks, John, for checking in.
Where is everybody?
I don't know.
In the process of checking in.
Yes. Hi, Jason. How are you?
I'm fine, thank you. Good afternoon.
Good afternoon. Good to see you. We're waiting for a few more board members so that we have a quorum before we can get going here.
All righty. Pulling up my background materials on my second screen and I'll be ready to go too.
That's what I did. Mr. Keckley, could I
Yes,
ask a procedural question? We actually do have 4 of the 7 board members on the call at the moment. It's on Zoom. Can I go ahead and proceed?
yes.
Ah, wonderful. Okay, and then we'll welcome our other board members when they arrive. They all are working and so forth, so we'll get to them when they get here. So I'm going to, before I go ahead and do, I'm going to call the meeting to order. We're at 4:34 according to my phone. And before I take roll call, if there are folks who are on the Zoom call, I would like you in the gallery, and you would like to speak during the public comment time, please sign up in the chat box. And please put in your name and the city in which you reside. And then I will use that chat box to acknowledge the folks who want to speak during public comment. Okay, so from there, we're going to go ahead and do a roll call so that we identify everybody who is on our Zoom call. And I'm just going to call out as they appear in my gallery. So the one that's to my left and first is the Department of Health. If you could identify who is in the room at the Department of Health.
Yeah, thanks, Heidi. In the room is Mark Espig over to the far side, David Keckley, myself, Bob Einschers, and Jenny Parcell back behind me to the left.
Thank you. Ilana?
Ilana Kirsch, member of the Board of Health.
Thank you. Mark?
Mark Fox, the Deputy Health Officer.
Thank you. Carol Havens?
Yes, member of public.
Thank you. Jane Greenwood?
Yes,
Also a community member, correct?
yes, from
Yes.
Granger, yes, thank you.
Great, thank you. Jason?
My name is Dr. Jason Marker. I'm the Vice President of the Board of Health.
Brett?
You're on mute,
You're on
Brett.
mute.
Brett Davis, Assistant Director of Environmental Health for the St. George County Department.
Thank you, Brett. Robin?
Hi, Robin Vita, Director of HOPE, Health Outreach, Promotion, and Education, St. Joseph County Department of Health.
Thanks, Robin. Michelle?
Hi, I'm Dr. Michelle Miglioria, family practice doctor here in town.
Thank you, Michelle. Max?
Hi, I'm Max Viebach. I'm a resident of Granger.
Awesome. Somebody has a screen name of DOH.
Department of Health.
Probably our Department of Health.
Okay, okay. Mary?
This is Mary Beth Spalding with the South Bend Tribune.
Okay. We have another screen that says just Mary. Mary, you're on mute. Okay, we'll pass on Mary. We'll find out more about that person later. Mary Kate. Amy Drake.
Amy Drake, citizen.
Thank you. Latoria.
Hi, Latoria Green, Manager of Community Health and Wellbeing, Tobacco Initiative, St. Joseph Health System, South Bend resident.
Awesome, thank you. Jill.
I'm Jill Greenwood. I'm a community member in Granger.
Great, thank you. Brandon. Oh, you're on mute, Brandon. Okay, we'll come back. Amy. Amy Murray is one of our board members. Amy, you're on mute.
Hi there, it's Amy. I just joined.
Thanks, Amy. Welcome.
Thank you.
John?
This is John. I'm a member of the Board of Health.
Thanks,
Lynn.
John. Emily? Emily, you're on mute.
Sorry, just tuning in here. I'm Emily Dean, Board of Health.
Awesome. Thank you, Emily. Richard. Richard, you're on mute. Okay, Sean?
Hello?
Hi, Sean. If you could state your name and your position here in the community, and if you're a community member or citizen, you can say as such.
Sean Haas, citizen.
Awesome. Thank you, and welcome to everybody to our Board of Health meeting. We have a full house and a full agenda. If I could remind everybody to please put themselves on mute, except for the Department of Health and Dr. Marker and myself. But if everybody could go to mute, that is really helpful. Prevents a lot of that interference and so forth. So I want to move to item number 2 is the adoption of the agenda. But before we go ahead and do that adoption, I request that we have an amendment to our agenda to add an agenda item under new business entitled Resolution Discussion. So that is I'm proposing that that be included in the agenda. So if it is recommended that the Board of Health members adopt this agenda with that amendment for June 17th, 2020, do I have a motion?
So moved.
Second.
Thank you.
Who seconded, please?
Jason Marker.
Thank you.
Any other discussion? All those in favor?
Aye.
Aye. All those opposed? Wonderful. We have adopted our agenda. Item number 3 is approval of our minutes. It is recommended that the Board of Health members approve the minutes of May 20th, 2020 that you have found and been able to review in your packet. May I have a motion?
So moved.
Seconded by Jason Marker.
Thank you, Jason. Any other discussion? If not, I would like to have a vote. All those in favor?
Aye.
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 All those opposed? We have approval of our minutes from May 20th. And then we have a second set of minutes. It is recommended that the Board of Health members approve the minutes of the June 3rd, 2020 meeting. Do I have a motion?
So moved.
Second.
Thank you. Any other discussion? If not, we'll move to a vote. All those in favor?
Aye.
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 All those opposed? Ayes have it. We've approved the minutes from June 3rd, 2020. Let's move to agenda item number 4. This is the board president announcements. I would like to address 2 pressing issues. First, racism as a public health issue, and number 2, public health strategies that fight COVID-19. We have all been witness to the racism and legacy of violence against the Black community. We have also witnessed an extraordinary outpouring of testimonies, peaceful protests, and new statements by leaders and officials to refocus our attention and actions to end racism. This board stands ready to engage in 2 really important ways. First, our board would like to move to a resolution declaring racism as a public health issue. Although this won't be accomplished today, I am proposing this evening that we draft such a resolution to have ready for our next board meeting. Secondly, our board is including specific language in our strategic plan to discuss the issue of structural racism. These actions are important and are just the first steps to ending racism in St. Joseph County. Next, I want to extend the board's sincerest gratitude to our health officer, our deputy health officer, and the health department staff for implementing key public health strategies to flatten the COVID-19 curve here in St. Joseph County. It's because of these specific strategies, our health department team has reduced the number of new cases, decreased the number of hospitalizations, and decreased ventilator usage. And to date, the health department has distributed 80,000 pieces of PPE to over 150 organizations. I think we would all agree that is amazing work. At the same time, I want to acknowledge the role of our St. Joseph County community and the role that they've played in flattening the curve. They've embraced these strategies, and frankly, the results speak for themselves. That is the end of the board president announcements. I'd like to move on to item number 5 and turn it over to Dr. Einters for his presentation and report.
Yeah, thanks, Heidi. This will be very brief, I expect. Everyone should have received already the report in writing. I don't have much to highlight. There are 2 areas. One is a very quick error. The caret on the nursing where it talked about tuberculosis cases should be less than 5, not greater than 5. And then I'd also just like to extend, as you did, Heidi, my appreciation to particularly all of our units, but particularly our environmental health unit. If you take the time to read the couple of paragraphs there that were submitted in the report, you'll notice the enormous amount of work that the environmental health unit did. One, to ensure that the Governor Holcomb's order was adhered to, and also to help with the St. Joseph County Election Board, the poll workers, and really doing what we could to ensure that our democracy functions and functions safely. Other than that, the only other piece is immunizations, as we talked about at our last board meeting, continue to be low. This is again the month of May. This is not unexpected at all. This has happened across the country, and we have been working hard to develop strategies to address the relatively low immunization rates that we have seen. They'll recognize that much of this will probably not pick up until August. So with that, I'm happy to answer any questions that you might have regarding this report.
So at this time, I would open it up to the board to ask Dr. Einters questions, engage in discussion about what we're seeing in his in the report. Yeah, Jason.
I have a question, and perhaps, Dr. Einters, you're not the one to answer this, but someone else on the call. When we made these educational stops at some of our community businesses to talk about the proper personal protective equipment that might be needed out in our business community, how are those educational messages received by our community?
Let me turn it over to Mark. He's in the room, Mark Espich, who's in the room, and he can give you multiple firsthand accounts.
Thank you.
It was received really well. A lot of times it was when the business contacted us for assistance. So we went out to provide that. Our main goal was to inform or educate on the contact time to make sure that they understood about the surface remaining wet for the length of time to deactivate the virus, and then just the proper use of PPE with the employees. But overall, the reception was great, and we just have had a lot of positive feedback from it.
Thank you, Mark.
Does the board have other questions for Dr. Einters as it relates to the report?
I have a question. Is the Department of Health still in possession of a large amount of masks, like paper masks? And I ask this because my office has not been able to purchase masks for quite some time now, and we received a large shipment of masks from Memorial Hospital, but where are people in the community able to obtain masks if they can't go to their normal suppliers, which we can't? All of our normal suppliers are canceling our orders.
We have, the answer to that question would be N95 masks, no. We still are unable to obtain N95 masks. For the, we have a few donated masks. We have a lot of alcohol-based sanitizer. We have some gowns, and we have a fair number of face shields that are still in in this room. In fact, got a few more in today. But in terms of procedural masks, I can put you in contact with Paul Burrows. He's not on. He's the one that keeps inventory there and can give you the exact number of how many we have of surgical masks that is. It's not a lot.
Right.
It's certainly nothing compared to what we had before. I cannot answer the question of whether the public can obtain, how easily they can obtain the surgical masks. Cloth face masks are ubiquitous, but the surgical masks more difficult perhaps to obtain.
Dr. Einterz, I would ask a question about just really continuing the conversation from last month about lead testing and immunizations and the mobile clinic. Has there been any progress? And I know that Dr. Fox is also working on that topic, but is there any progress in terms of like with the South Bend schools in ramping up lead testing and immunizations?
We're moving. Mark, you want to respond to that question?
Yeah, we're moving ahead with planning some summer events focused on back to school immunizations as well as lead testing, in support of the South Bend School Corporation's enrollment requirement for lead testing. Some of those will be kind of, if you will, independent Department of Health events, just because it's been a little bit tough coordinating with the schools based on their time frame for ramping up. But then, once there's more clarity about the school's time frame and things, we had a plan for kind of an immunization catch-up round with all the South Bend schools and the empowerment zone schools this spring that got shelved because of COVID. And so our hope is in the first few months of the fall fall semester to be able to implement that plan essentially intact from where it is, from where it was as we were planning it this spring. So.
I would add to that in anticipation of increasing need for immunization nurses, that every nurse is being cross-trained and brought back up to speed so that we can lean on our entire nursing staff to deliver immunizations.
Awesome. Thank you for that update. And I have to give a shout out to the Hope unit. I see that you guys did a virtual cooking class and you had 20 participants. Am I reading that right, Robin?
Yep, you're correct.
That's fantastic because I just think that's amazing. That's totally innovative in getting people engaged in a completely different way on a really important topic. So shout out to you and your team for sure.
Thank you.
You're welcome. Anybody else have any questions regarding the health officer's report? If not, let's go ahead and then turn it over to the Deputy Health Officer, Mark Fox, to give us an update on COVID. And just as a reminder that Mark has done a written report for us too that was in our packet. Go ahead, Mark.
Yeah, so the written report really focuses on the month of May. The big things are that, the Unified Command continues to meet regularly. I think that has worked really well, working with the local health systems and having Jeff Ray involved as kind of a liaison to the elected officials and the business community. So I think that framework really has worked very well for us. A lot of it relates to interaction with the State Department of Health around testing, around the Governor's Back on Track plan, the testing site, and contact tracing. We've had some ongoing discussions with Dr. Box and others at the State Department of Health in relation to those things. Our focus has really been on trying to ensure access to follow-up and primary care in response to COVID testing. And so I've really been working closely with the health system partners and hope to be able to expand some of the testing opportunities with them beginning in July. And then I think relative to contact tracing, you know, Dr. Box did a webinar this week focused on K through 12 schools, especially, and kind of the role of local health departments and partnering with area school districts with return to campus for the fall semester. We've done a lot of work with at least some of the area higher education institutions, which I think pose different challenges with respect to residential life, academic, you know, programs and services and spaces, as well as dining hall and student organizations and recreational facilities and all those things. So, so that's been kind of a big focus of what we've been doing here over the last few weeks, especially. And so really preparing for when students come back, both K through 12 and higher education, it's going to be important that we are able to have access to reliable testing, ideally rapid testing, and very responsive contact tracing. And that will require some interface between, you know, University Health Services, the local health department, and the State Department of Health. So, but I'd be happy to answer any specific questions about the data or activities that we've been focused on as part of the COVID response.
Thanks, Mark. Do board members have questions for Mark?
I have a
please,
question.
Emily, go ahead.
I just wanted for myself really some clarification about who has access to testing now. Is it for the county? Is it still just people who are symptomatic who can receive a test, or has it been open or think they mentioned where a testing might be needed?
Yeah, so, you know, as of the end of last week, the Optum test site, which is the one contracted with the Indiana State Department of Health, basically has said anyone can get tested without regard to symptoms or exposure or anything. That's been a shift because through most of the last 3 months, the state has actually been more restrictive, and our local health systems really have operated more on clinician judgment and discretion about, is there a plausible story here in terms of exposure or risk or, you know, something that warrants testing. So, you know, the local health systems, you know, I think they're still operating in terms of clinical judgment. And Optum now should be, anyone who says they want to test should be able to get a test through Optum. The local health systems aren't quite that wide open, but, you know, I think they've also used reasonable judgment in terms of, you know, even pursuing what might be otherwise have been considered fairly vague symptoms. You know, any symptom basically is a basis for getting tested, just because the symptoms can be so variable, or the presentation can be so variable.
I have a question, Mark. We've talked about this previously, but I'm wondering if anything has changed. In the past, we talked about the cost of the tests and the fact that apparently the state was bearing the cost of the test. Is that still the case?
Yeah, so the state's contract with Optum, you know, covers not only their personnel, but also the cost of the test. There's a little variability, I suppose, in the health systems to some extent on this, in that, you know, Beacon and St. Joe in particular are asking about insurance status. So under the federal legislation, insurers are required to cover the cost of testing. But there's also a mechanism for the test to be covered for those who are uninsured. And so, for instance, LabCorp can submit a claim to the federal government for people who are without insurance and get at least some compensation for that test. South Bend Clinic has basically been testing everyone. All of them have been testing everyone, irrespective of insurance status, as far as we can tell and as we understand it. South Bend Clinic has not been as aggressive in capturing insurance information because they wanted to ensure few barriers to the ability to access testing. But that's created some confusion because, especially early on, we heard that the labs were then trying to bill patients for the test because they weren't officially declared uninsured. So there's been some back end work to try and clean that up. But their intent was to have as few barriers as possible to getting tested.
Thank you.
Mark, I have a question. So with regard to Elkhart County, they've had quite a significant increase in cases. If I read things right, in May, they had a 350% increase in their positive cases. And I'm just wondering, are we in contact with them? Are we concerned about their cases? Is that cause for us to be alarmed about our own health system? I think I also heard that their hospitals are not quite at capacity, but coming to that. So I wonder if there's going to be a spillover into our community, and your thoughts about all of that.
Yeah, I mean, all legitimate concerns and good questions. So, you know, we've had, in various ways, we've had contact with health folks, elected officials, and business owners from Elkhart County. Across Unified Command, so the health system leadership as well as the health department has, and you know, they kind of pursued their own path at some level, and just within the last week now have issued guidance and or recommendations related to face coverings. But they, you know, it took a while for them to move on that, and it's appears to be somewhat softer than our own order. 2 or 2.5 weeks ago, I think, Goshen Hospital enacted their surge plan, and they were the first to experience any real capacity issues. Elkhart General certainly has seen an increased census, and they have slightly more COVID positive patients hospitalized than Memorial at this point. They're almost 50-50, but probably just a few more at Elkhart. But you know, we've been in touch with them, just trying to anticipate what the spillover would be in terms of patients needing hospitalization in St. Joseph County. You know, all the hospitals their census is increased over where it's been since March, as they've kind of reinstituted elective procedures and kind of routine diagnostic and therapeutic procedures. And it becomes a little bit of a fuzzy number because they had created increased capacity in anticipation of COVID. So now their census is up, but they're still not quite at what their normal operating capacity would be. And so there's still some flex to increase if needed. So, you know, we're not feeling crunched in terms of hospital beds, but we certainly are, you know, recognizing that even as Marshall County has seen an increase and other surrounding counties, that we would be a likely overflow destination for a lot of those patients.
Yeah, and that's exactly my thought when I'm reading these reports. LaGrange is increasing dramatically. Kosciuszko is seeing an increase, and of course Elkhart and Marshall. And so I just wonder what that represents for us. So thanks for speaking to that.
Had some contact with Marshall County as well, obviously, since St. Joe has a facility there, and with Bremen as well. And then, and you know, their health officer has been sick, and so they have an interim health officer who's kind of stepped into that role probably a month or so ago. And so we've been in touch with their elected officials and health system and Department of Health folks.
Wow.
Around all this.
Well, Mike, just wrap up comment on that. Then thanks to you and Bob for extending yourself to the other counties in Northern Indiana. That certainly, I'm sure, is much appreciated. Jason, you wanted to?
Yes, Dr. Fox, I want to say a thing that I think is true, and maybe just get your reflections of whether it's accurate or not from what I've been reading, and maybe some myths that I've been dispelling here in my own practice. It appears that a certain percentage of the increased uptick in cases in some of our surrounding communities, and of course even in St. Joseph County, are increases because of increased testing, but that is not the only cause of the increased number of cases, that there are an increased number of hospitalizable and more ill patients as well, suggesting that not all of the increase in cases is simply due to increased testing. I've had some patients come in who've believed that, oh, there's really nothing to worry about in our community or our surrounding communities because it's just because we're testing more. But I think looking at the broader evidence suggests that there actually are more severe cases, and it's not all about the testing. Would you believe that that's correct from your look at the data?
Yeah, I mean, obviously we see some increase just from increased testing, and unfortunately, especially now as laboratory testing has gotten more fragmented, the true denominator is much more slippery. When LabCorp was doing 95% of the tests in the county, we're much closer to a good estimate of the positivity rate. We get no report from Optum of the negative tests, Optum or Quest, and then a handful of other entities. They are ultimately reported to the state, but not necessarily, especially the negatives are not reported in as timely a fashion as one might hope. So I do think that my best estimate is that our positivity rate has gone down in St. Joseph County modestly. From what I can tell in Elkhart County, the increased number in cases is not solely a reflection of increased testing activity. So I think that there is a true increase. And fortunately, you know, our hospital census in St. Joseph County has come down over the last month. And so while I think there has been an increase in hospitalizations, again, especially in Elkhart County, and so if you take the region as a whole, there is probably an overall increased COVID census. In St. Joseph County, it has come, knock on whatever fake wood my desk is made of here, it has come down. But certainly there are still some, you know, the folks who are hospitalized, there's some really sick folks, you know, that are requiring hospitalization.
Thank you for that. I just think it's really important as a board that when we're in community situations to share some information about what we think about how it's going. There are some areas that are bright spots, and there are some areas that are still very concerning, in that there's a lot of science between trying to accurately interpret some of the data, and there are lots of bits of misinformation out there on social media that can lead some folks astray, and I think we have an obligation to try to dispel some of those when we can. So I appreciate that extra bit of interpretation.
Hey, Mark, could I ask a follow-up question to the testing criteria that you said that at the end of last week, the criteria changed, and now virtually, if you want to test, you can get a test now. You don't have to have symptoms or have been in contact. What was it? What's the rationale? What caused that shift?
You know, I have not had any conversation about that particular issue with State Department of Health leadership, so I don't.
Okay. I was just curious, why now? What happened that we shifted?
I think part of it is, you know, they've had a contract with Optum, and certainly in some locations, including in South Bend, there's been less utilization of those sites than they had anticipated and hoped. And so, again, I think part of it was to increase access to testing and addressing the perception that, I'm not sick enough to go get, if I call them, they aren't going to test me. And so I think it was to dispel that, is kind of my sense of it, but I have not had a specific conversation about whether there were other factors that drove that particular decision.
And then one last question from me. How is the jail doing? How's our local jail doing?
By and large, I think they're doing okay. They do have some capacity for isolating and quarantining folks at the jail. They have a testing protocol in place. So, there have been positive cases from our local jail and other area correctional facilities. But certainly the county jail, I think we're in reasonable shape and have had some good communication with them when issues have come up.
Great. Any other questions for Mark regarding COVID-19? Okay, you guys. Thank you.
Dr. Fox, this is John Lynn.
Yeah.
On the if you elect or want a test, is the procedure still to call your physician, or what is the procedure for getting access to an elective test?
Yeah, so in the first instance, people should call, their primary care source. Certainly Beacon, St. Joe, and South Bend Clinic, all, they have COVID hotlines. More and more, some of the other practices are testing. So, Activate has done a lot of tests. The HealthLink especially is doing more and more testing, and then some other practices as well. And then if people don't have an established primary care relationship, then still the 211 phone mechanism is still kind of the best place to go to get guidance on where they should go for testing based on insurance status and geography, basically. So there's been some change, even over the last few weeks in terms of there's probably some decreased access to testing, particularly on Sundays in St. Joseph County. So, I think more and more practices are having to figure out where COVID fits into their regular life cycle of patient care and work-life balance and everything else. And so, I think there is some decreased access on the weekends generally, but especially on Sunday, it's a little bit tricky.
Thanks, Mark. All righty, so if that concludes that section, let's move on to new business. I believe, Bob, you're going to talk about the nursing unit fee schedule and then the unit spotlight.
I'm not sure it was me. Is Amy on? I think she was going to talk
Okay,
about
sorry.
And then I can talk about the spotlight though.
Okay, Amy, are you on the call? I don't think she's on the call. Do you want to go ahead and
do the spotlight, the nursing?
Do the spotlight, and then we can, maybe Jenny could email her or text her or something.
And Christine Hines was to give the spotlight on the nursing program, and she had a very severe illness in her family, and so is unable to do that. So I'll go ahead and do it on her behalf, recognizing that, of course, she's the expert on the nursing unit. And with Jenny's operating the computer behind me, and she'll have to do the put the presentation up on the screen for everybody. But she's texting Amy first. So. We don't have it. Okay. Looks like we needed Christine for that. And so
I think it was in the materials.
So at any rate, let me go through it real quickly. Without,
Heidi, was the nursing unit presentation in the packet that went out to the board members?
Yes, it was.
Yeah.
So they have that.
Okay. Good.
Thank you,
Jason's
Jason.
sharing it. Thank you.
There we go.
Perfect. All righty. So, good job, Jason.
Thank you.
Doing it on behalf of Christine. The nursing unit has, if we include everyone, nurses and registrars, 15 full-time folks, a couple of them funded by the grant. Next slide. Christine apparently wanted to emphasize the senior moments that do happen around here, noting that we have 138 years in total. Those pictured are not all of the nurses, and in fact, you're not actually seeing the most senior ones there as I look at it myself. But we have a terrific crew of nurses with a lot of experience and bring a lot to the table here. Immunizations are active at the 3 clinics, if you will, South Bend, Mishawaka, and we have a mobile unit. Tuberculosis is done here at the County City Building, and then public health out in the community, communicable diseases led the case management for that. Immunizations, we've talked about quite a bit. There are 19 childhood vaccines, 17 adult vaccines, 36 mobile clinics in the last year. And we offer travel vaccines as well, though yellow fever continues to be in shortage. I won't say much about tuberculosis, except that we do manage it here, both active and latent TB, and directly observed therapy for our active TB patients. It's a disease that goes back years and centuries, but still around with us today. Public health nursing has done an absolutely phenomenal job during this time of COVID. The numbers are there on the screen, but the contact tracing has been quite a task and quite a challenge, and they've risen to that challenge and done it beautifully. The state more recently took that over, and our public health nurses have responsibility for following up on those whom the state cannot follow up on, though quite frankly, those are very, very difficult to do. The nursing as well played a very significant role in helping the city, and continues to play a role in helping the city with the isolation and quarantine center out at the Motel 6. There have been 80 or so cases of individuals who have been out there. Communicable diseases are in your report. I won't go through that anymore. What lab we've talked about already. Our goals for the coming year, and of course we're going to have a strategic plan discussion of the Department of Health at next month's meeting, likely. But we'll talk more about goals then. But from Christine's perspective, she's working on cross-training, as I mentioned in the discussion previously. We're looking at extended hours, particularly for immunization, and we'll be doing that weekends and some evenings, or at least late afternoon / early evening. And those are really the bigger issues. We'll be looking as well at increasing our capacity to address issues related to immigrants and refugees, but more on that at a later meeting, I think. So in a nutshell, that's the nursing unit, and happy to answer any questions to the degree that Mark and I can.
Thanks for filling in, stepping into that. Anybody have questions about the nursing department? Kind of a high-level overview, and I think that I can speak for the board here that we look forward to next month's conversation about the strategic plan, so we can get into some more of those details about what each of the units are going to be focused on. I think Amy has joined the call, so we can switch to the topic about nursing unit fee schedule. Hi, Amy.
Hello, how is everyone?
We're good. Good to see you. So you want to talk to us about the nursing fee schedule?
Yes, presented before you is a resolution to increase some of our fees for our immunizations. Based on our contract that we signed with VaxCare, we are not getting compensated what we are paying for the vaccine. So we want to increase those certain fees to have a small cushion so we don't have to do this too frequently. We also are going to add, I believe it's 2 vaccines to our list that we hadn't offered before that VaxCare does offer that we would like to start offering in our clinic.
Okay. So right off, I have a question. So are you suggesting that not every vaccine got an increase, only certain vaccines got increases?
That is correct. Only certain ones got increases if they were in the red to begin with based on VaxCare prices, or our margin got very slim. That way we don't have to do this frequently. I guess put a little padding in it so we can go 5-6 months without having to do this each time, since it is a item that requires Board of Health action, and then it has to go to the council for their approval, which is a 2-month cycle. So we're trying to put a little leeway in there so we are covered when VaxCare increases their prices.
Okay. What percentage of the vaccines would you say saw this modest increase?
I would say probably at least half.
Okay.
Some state exactly what they were. Most of them had a slight increase, some more significant.
Are there questions from the board? Because it sounds like we're going to be voting on this fee schedule so that it can advance to the next stage.
Correct.
Yeah.
I have a question.
Yes.
I know, like, what you're getting reimbursed from each individual insurance company. So have you set these prices that you propose to be higher than the highest reimbursement? That's what I would recommend.
Yes. That's why each vaccine's at a different price amount. VaxCare is telling us what they are going to reimburse us for. So we are adding a little bit to that. The administration fee has also gone up. It was $12 in the past. Medicaid has increased that to a $15 reimbursement. That's why we're requesting that to go up to $15, since that is the max allowable to be reimbursed back to us from Medicaid.
Okay. And then, but in terms of the, like a patient who comes in, say, with Blue Cross Blue Shield, and that could get reimbursed at a higher rate than a Medicaid patient receiving the same vaccine, we are asking for the higher rate, like we're billing at a higher rate so that we can recoup everything possible from the commercially insured patients as well?
We're not billing the commercially insured. That's going through VaxCare.
Okay.
So that we didn't have to get separately credentialed and contracted for all the private insurers.
Okay.
So we get the administration fee from VaxCare, and then we can use the VaxCare stock on people, who are paying out of pocket, if you will. But then we're buying the vaccine from VaxCare, so we're making sure that we're collecting enough to cover that reimbursement to VaxCare, so we don't lose money on that.
Right. We should be collecting more than what we're paying out. Okay.
Jason, do you have a question?
Yeah, it may be a question for Amy. It may be a question for Dr. Einters, but when we periodically will have a situation where a certain vaccination is unavailable to us, as rabies vaccine and rabies immune globulin has been in the past, do we just have a single supplier, and if they say we're out, then we're out? Or are there alternatives for where we get that? And if we truly find ourselves in a position where we are unable to obtain that by any means, what is our general protocol for managing those patients? Especially, again, I'm thinking about the rabies just because we're coming into summer, if that should happen again for us like it did last year.
Go ahead.
Yeah, I'm expressing my ignorance, so go ahead, Amy, help me.
Yeah, I was just going to mention that in the past, the rabies vaccine was purchased through Sanofi, and of course that's been unavailable. And I know Nico has reached out to some of the other vaccine providers when a vaccine hasn't been available through our normal purchasing channels, and has had some success in getting vaccines from different vendors. That's not a problem on our end as long as we can get them set up as a vendor. However, I have not heard anything regarding the rabies vaccine specifically that would be available through a different vendor. But we have the option to go with any vendor that's willing to pretty much fill out the vendor paperwork and get set up with St. Joe County.
That's great. And then if there's just not an option for that, is our nursing staff making referrals on to an emergency department in the case of a person who presents with a need for this kind of vaccination?
That I would not be able to answer. I'm not sure if Dr. Einterz could answer that.
We have not encountered that in my now almost 2 years with the department yet. Again, knock on wood. But yeah, Nico, when we do have shortages for whatever reason, Nico has various contacts that she can reach out to. And so emergency departments certainly would be one of them for something like rabies.
Great, thank
For
you.
yellow fever, and for yellow fever, we're aware of
right
a couple of other sites, but you have to go to Indianapolis or Chicago or maybe Grand Rapids for that.
Right. That's what I've done in the past.
All right. So if there are not any more questions, I think I'm going to then ask for a motion to accept the nursing fee schedule as it is presented.
So moved.
Thank you,
I'll second
Ilana.
that.
Thank you, Jason. If there's any further discussion, if not, we'll go ahead and move to a vote. All those in favor? Aye. All those
Aye.
opposed? The ayes have it, so we have approved that nursing schedule and it can move to the next stage of the process.
Thank you.
Wonderful. So now we're still in new business, and now we're going to talk about the newly added agenda item, which I was calling the resolution discussion. As I talked about in my in the president's announcements, this board is interested in moving to a resolution that establishes or declares that racism as a public health issue. And so I just wanted to have some conversation about that and talk about that, and then with the goal of drafting a resolution for our next meeting. Marion County has been in the news that they have done this. I think it's been about 10 days or so. So that's also where I'm getting some of that language. I've had a few conversations with folks who've been around that table and so forth. So I'm interested to hear what the board might have to say about moving in this direction.
I guess I just have a question. I support the idea of a resolution. I'm just wondering what does that mean then for the board? Like, if by passing a resolution, is it just kind of putting it into the record, or does this open up opportunities for certain types of actions that the board can take or then the health department can take? I'm just curious about that.
It's a great question, Emily. It would seem on the surface that a resolution seems to be more of a formality. And that it only exists in name only, right? So we come together, we pass this resolution, and we feel good about ourselves that we've passed this resolution. But in the end, what does it really mean for us? I think it's best explained through a resolution that this board passed last year. So this board last year passed a resolution to encourage all school districts in St. Joseph County to adopt lead testing as part of their their kindergarten entrance requirements. And then this board, along with Mark Fox, went to numerous school districts to do presentations and have conversations with superintendents and their nursing and so forth. And the South Bend Schools was the first to adopt a policy where now their kids in the incoming school year, that lead testing is now part of their entrance requirements. So on the surface of things, while it's not a law or it's not an ordinance, right? That resolution, because we as a board agree and we hold ourselves accountable to that, we followed through and met with superintendents and did those presentations, that we were able to yield and help the South Bend School Corporation get a policy such as this in place. So this is one of our levers as a Board of Health that we have at our disposal. We don't want to use it on a whim. We want to definitely reserve it for the things that we think that are most important. So I really appreciate that question and getting an opportunity to answer that. Other thoughts about working on a resolution such as this?
I would definitely support it, Heidi. I know in my field, especially in obstetrics, there's been a lot of press given to this issue of women of color having obstetric complications and dying at a disproportionate rate compared to white women. And it's clear that this is a huge problem, and anything that we can do as a board to support, promoting listening better to our patients of color and giving them an appropriate obstetric experience and medical experience is life-saving. And so I would wholly support that.
Yeah. Thanks, Ilana. Yeah, Jason.
I think that our community would be gratified to have some leadership from the health department around this. And to that extent, I think time is of the essence. Obviously, this has been a longstanding problem and probably looks to be one for quite some time. But if there is an acceptable resolution that is prepared between now and our next meeting, I don't know that we would necessarily need to defer to the next meeting to put that resolution into play. Certainly, the Board of Health could release a resolution that is mutually agreed upon at any time. And maybe that is actually something that can happen before our next board meeting if we work on this asynchronously.
Okay. I hadn't considered that. That's a good suggestion.
Mm-hmm.
Anyone else? Board members? I just want to make sure that I give everybody an opportunity and don't just like race through things. Well, awesome. Believe me, I mean, as I said in my announcements, I think that this is a really important move for us. And I look forward to, as you correctly pointed out, Alana, is more of the listening to our community members and leaders and have them help us direct what would be useful. How can we be helpful to them, and how do we move things in the right direction and end racism?
In response to Dr. Marker, and in response to you noting that resolutions are reserved for matters of importance and position statements of this board, I would suggest that it would take approval of the majority of the board. You can hold a special meeting at any time. We've done that just recently for the budget. But I would let Dr. Marker know, I think it would take the board coming together, having a quorum, and approving a resolution that is drafted and proposed. So I don't think that, notwithstanding the timing, special meeting can always be called upon, but I think it takes full board action.
Awesome. Thanks for that clarification. Appreciate that.
Thank you, Mr. Keckley.
Yep. All right, you guys, why don't we move on to old business? The establishment of the Department of Health Foundation. Are there any updates, Bob? I wasn't sure.
No, the articles of incorporation were submitted and accepted, and so now we're moving toward getting 501c3 tax exemption status. That'll take several months, but the foundation is established, if you will. So
okay.
It's good. We're moving.
Awesome. Thank you. And then if you would be so kind, is there any update on the water board, advisory board, excuse me?
No further updates. The letters have been sent and we have followed up with the letters asking for the designation of the individuals from the commissioners, city, et cetera. Okay. And so we're waiting, still waiting. We've gently nudged them.
Yeah, and I'm sure that you guys already know this, that there's talking about wastewater. There's conversation at Notre Dame about monitoring the wastewater for COVID. So while we started, we haven't had a water board now, advisory boards for like, I think 15 years, if I recall that correctly. Gosh, how timely this all is that we're reestablishing these advisory boards. So I would urge us to move quickly on these because they're becoming increasingly important. So I look forward to that next step. Okay, so the next item on our agenda is the strategic plan update. The board members have gotten a draft of the strategic plan and the roles and responsibilities of a board member. And I'm going to turn this conversation over to Jason.
I want to thank everybody on the board who's been contributing at a very high level to this emerging strategic plan. Obviously, it is still in draft form, and at some point that will need to be converted into a final document for us. Where we are right now is we've collected a lot of feedback, and we've sort of put it into a little longer item, a little longer document than it needs to be, with the idea that at some point we need to have some conversation around some of the specifics that are in there in order to move towards a final document. Obviously, if you have it in front of you, a preamble, a mission, and vision, just some basic things. There are some principles there which are sort of not exactly like vision statements. Those of you who've done a lot of strategic planning work, you'll see maybe some different naming mechanisms than you've seen in other ones, but Heidi and I thought that a set of principles by which we could guide our work would be useful. And then we have a series of goals, and this is where I think the majority of the work will be for the board as we wrap up this process. We have the 4 goals listed around advocacy, funding, partnerships, and accountability. And under that, we've left a fairly longish list, longer than most strategic plans might have, of how we might flesh out the goals under each of those main areas. And the question comes for all of us is, what do we like in those individual strategic goals? What needs to change about those? How should they be thinned or expanded? We want to make sure that those are actionable sorts of things. We're not looking for a strategic plan on which we affix quantitative data. Certainly within the section on accountability, we believe that there are items here that we can be held accountable to as a board, but not in the sense of, this is not the place for, we wanted to do 1,000 lead tests and shame on us, we only did 950. I think that we want to use this as an opportunity to say, what are the high level things that we want to be able to respond to support our community and its better health. Before I sort of pause on that general line of reasoning, same thing with roles and responsibilities. Certainly, the Indiana Association of Local Boards of Health supports having boards self-accountable to their roles and responsibilities, and we should be no different in that expectation for one another. And we're putting together that list as well. I thank everyone who's contributed items to that, and would encourage you to continue to contribute and give us feedback on the individual specific items which are within the board member roles and responsibilities document. I think that may be enough from me about this. Heidi, if you'd like us to have more of a conversation around some specifics in here today, that's fine. If that's something you want to continue with offline and bring for final resolution, perhaps at the next meeting or two, that's fine too. One of the things that Heidi and I have talked about is we believe that the board's strategic plan should be complementary to the department's strategic plan. And we would like to hope that the department's strategic plan would be somewhat complementary to ours as a board. And so it's good timing, I think, that we're working along the same general timeline as the department's strategic planning process. To that end, we may not want to move to a final plan at any quicker pace than the department is working on for theirs.
Thanks, Jason. Yeah, I think what I was hoping that we could do is, if there's just some conversation that we want to have about what we're seeing, if we think that there are some things that could be collapsed or, those kinds of things. But I also wanted to make it publicly available and also publicly shown and discussed, so that our community knows that we're engaging in this process. I think that's really important also for transparency's sake. So if the board members have any questions or discussion that they want to have about the strategic plan, please unmute yourself and have a conversation. And Bob, or Mark, if there are any comments that you have, I certainly welcome that.
From my perspective, I think it's terrific. I appreciate Jason's comments that it should complement and dovetail with the Department of Health strategic plan. I know all of you, none of you have seen the initial draft of the Department of Health strategic plan yet, but I can assure you that what you have in your plan and what we have drafted preliminarily in our plan overlaps very nicely. And we'll obviously have more discussion over the next couple of weeks.
Other board members?
What we plan to do, again, over these next couple of weeks, as Dr. Einters has suggested is happening on the department side, is to continue to do some final refining on this and really do hold it up next to the department plan for one last bit of polishing, and then we will bring this back for a vote. In the days ahead, I would encourage you please to take a 15 or 20 minutes, half hour of your life and really sit down at a quiet moment where you can really devote a little bit of this. It's a very short document, but I think it's succinct and to the point, and give Heidi and I some further feedback about areas that you think there's some redundancy where we can clap some things together. I think most importantly, if there are areas that you finish reading this and you say, why wasn't that in there? We want to hear about that. We don't want to miss something really important here. I think we've tried to avoid that, but that's why we have a board looking at this and not just an executive committee. So please do that and give us that feedback. Even if it's just to say, I think this looks good, you can proceed. We'll be reaching out with that kind of an ask, but then we'll know that you're proactively taking a peek at this so we can get it ready to look at against the departments.
Awesome.
Okay.
Thanks, Jason. Oh, Emily, please.
Yeah, no, I was just going to say thanks for that discussion you had about the accountability piece, especially. When I read through it again, because when I hear the word accountability, I start to think of things that are quantifiable or, tangible or something. So I will kind of look at it with a different eye, maybe, and think about that in a slightly different way. So thanks for kind of giving your thoughts on that.
Heidi and I have talked a lot about the fact that the work of the board is to help guide strategy, to talk about the big things that need to be talked about in community public health. And it really is the department's job to operationalize some of those things. So we should be held accountable to coming up with the big things, to looking at the way our department is operationalizing that in our community and feeling comfortable that it matches up with what we're trying to do as a community. And that doesn't lend itself well to the sort of quantitative strategic planning accountability that many of us have done with other organizations. So that doesn't mean that there couldn't be some things that are a little bit more, quantity driven than quality driven at the end of the year. But yeah, that's a very important philosophical difference between ours and the departments, I think.
Yeah, thanks for that.
Awesome. Okay, so we'll look forward then to next month, and hopefully we're going to have a final copy and we'll be able to take a vote on it.
Great, thank you.
So that concludes our old business, and item number 9 is board notifications, and we have none. So let's move on to item number 10, which is our public comment. And before I read the sort of the directions of that, at the beginning of the meeting today, I said that if you are a person who wants to speak for 3 minutes, that you need to sign up in the chat and put your name and the city in which you reside. And then I will call upon you based on the order in which people have signed up. And I will be keeping a 3-minute time, and then I will let you know when the 3 minutes is up if you should need that whole 3 minutes. So let me read this paragraph to you. At regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and the city for the record. Personnel issues are not to be addressed during open sessions. I thought I printed out the other side. During open sessions, and then the last line is that we want to make sure that comments and statements are respectful. Let us proceed. So Jane Greenwood, you have the floor for 3 minutes. Are you still with us? Yes.
Yeah, I'm here.
Yes.
There. I just, unmuted and everything. Hi, I'm Jane Greenwood. I live in Granger. And I guess what I want to address is the masks. And what I really have here is just more what other respected doctors have said. And I'm of the understanding this will expire or you will renew it, I think in July. Is that correct?
That's correct.
Yeah, okay. So, on May 21st of 2020, the New England Journal of Medicine stated, "We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure of COVID-19 as face-to-face contact within 6 feet with a patient symptomatic, and that is sustained for at least a few minutes." In April, the American Medical Association said face masks should not be worn by healthy individuals to protect themselves from acquiring respiratory infection because there is no evidence to suggest that face masks worn by healthy individuals are effective in preventing them from being ill. The CDC policy review in May said, "We do not find evidence that surgical type face masks are effective in reducing laboratory confirmed influenza transmission, either when worn by infected persons or by persons in general community to reduce their susceptibility." Dr. Fossey himself, a couple weeks ago, acknowledged masks are not 100% effective and said part of the reason we should wear them is symbolic. There's a Dr. Nonansi Rajeski, she's out of the Mayo Clinic infectious disease specialist, and she said regarding a mask, "If you are healthy, there's not a thought to be of any additional benefit to wearing a mask yourself because a mask is not airtight and does not necessarily prevent breathing in of those viral particles, which are very tiny." And I've heard it compared by other doctors. It's like a chain link fence being used to keep out a mosquito. A Dr. Russell Bloylock, who is a retired neurologist out of South Carolina, in May 11th warned in an article that not only do face masks fail to protect the healthy person from getting sick, but they also create a serious health risk for those who wear them. The bottom line that is if you are not sick, you should not wear a mask. A doctor, infectious prevention specialist, and Eli Bravenovich, he's a professor at the Medicine of Epidemiology at the University of Iowa School of Medicine, said on Twitter, "Masks won't protect the average person because they wear them incorrectly and auto-contaminate themselves. I've never seen a person practice hand hygiene before removing a mask in public and then after removing the mask." He told Forbes that the average healthy person does not need to have a mask. There's no evidence that wearing one on a healthy person will protect them. And then other experts have warned that they give us a false sense of security. So people forget to wash their hands or do the proper distancing because they feel protected by the mask. So I just ask that on July 4th, you make them optional. Thank you.
Thank you, Jane. Let's move to Kelly Haven. Carol Kelly Haven. You have 3 minutes.
Very good, thank you. It's really challenging to make sense of all of the information that's out there about the virus. You know, how widespread is it? What is the survivability? How is it even spread? The best take I can make on it is that we need to be focusing our efforts on a small segment of the population that's particularly vulnerable to it, with much less emphasis on the rest of us. The damage that we've done to our economy, to our schools, our organizations is scary and hopefully recoverable. My piano teaching business has survived. We did 2 months of e-lessons, which is not very ideal, but we got through it and we even did a recital, woohoo. So I survived, but 5 of my students are from households where the family has lost a job because of the shutdown. And things are going pretty chaotic in some of those houses, which is why I decided to carry those students financially so that something normal could keep happening in their lives. But I can tell from what's going on there that we need to get our jobs back, get our businesses and services open again, get our graduates launched. Masks are one of those aspects of the virus about which there's just an awful lot of contradictory information. But one thing that's pretty obvious is that it causes us to rebreathe our own particulates that our body is trying to get rid of. I've worn a mask when I went to the doctor for a relative in our household who's got a trait. I wore a mask when one of my students asked me to because they had a relative they were concerned about. And I wore a mask all day long at the election because I worked the election, and my employer for the day, St. Joe County, told me I had to have a mask. I was really glad to see that we didn't ask any of the voters to leave if they didn't have a mask. The few people who came in were allowed to vote, and that's certainly what it needs to be, because you can't be infringing on people's rights. Wearing the mask for 13 straight hours, it was hot, it vision impaired me, it made my ears hurt, and the scariest thing was I had to pull it down frequently to breathe. So I don't think we should be a whole county that's going gasping, I can't breathe. We have to use common sense here. When we're around people who are vulnerable, special rules need to apply, but when we're around healthy people that are not concerned, I think we need to get back to our lives.
Carol, that's 3 minutes. Thank you so much for your comments. Amy Drake is next, and you have 3 minutes.
I'm here today to express my frustration with this unelected board for threatening to extend its already overreaching mask order. Residents and businesses had no say in this decision. It all sounded rather political. First, the mask order was put in place because it sounded like Mark Fox and the South Bend mayor were not happy with the governor's decision to lift the stay-at-home order, even while the curve appeared to be flattening. Remember, the governor didn't mandate masks, he recommended them. Then, when the governor announced last week that we are moving into the 4th phase of reopening, right on cue, the health department issued another press release saying it expected to extend its mask order past July 4th. It took on a very authoritarian tone, reminding citizens that it had the authority to establish stricter recommendations for our county. Further reading of the order indicates that the county does not want to lift the mask order until we reach herd immunity, which we know could drag on forever. And they don't seem to have any plans to measure herd immunity, which doesn't make sense at all. So COVID hysteria has swept the nation. Everyone's scared of dying, but what kind of data are we seeing? Look at our county's data. First off, everyone is not dying. We've had 59 deaths reported in a population of 272,000 people. That means about 1 in every 4,600 residents here have died. Look further, who is dying? Statistics show 45% of cases are 80 and above. Another 25% are 70 and above. That means almost 3/4 of the cases are over the age of 70. And many of these deaths are in nursing homes. Nationally, it's the long-term care facilities that are accounting for at least 40% of all deaths. So what about deaths under 50? There is one case in our population of 272,000. We don't know if this one person had underlying health problems. We know that people with comorbidities tend to be more affected. So my question is, why is the whole population being asked to bubble wrap? We're all being asked to wear masks and to social distance. There is a certain population that may need to take extra precautions, but not all of us should be forced up to give our freedoms to show our faces in public and maintain regular social contact. Consider kids. British scientists said last week that school-aged children are more likely to be killed by lightning than from coronavirus. No child in St. Joe County has died. In fact, the flu is more dangerous to children. This past flu season, there were 180 reported juvenile flu deaths in the United States versus about 20 from coronavirus. With numbers like this, is it justified for the health department to mandate masks for our kids in school? What about increased cases? Cases aren't necessarily bad. They're bound to increase as we increase testing. At a Tyson plant, 199 workers tested positive and only 1 showed symptoms. This is great news. While corona is always touted as a killer, here we are seeing that even all these people are having mild cases. They don't even know they have it. In fact, a Healthline article said anywhere from 25 to 80% of people are unaware that they have the virus. This is good news too for herd immunity because current vaccination trials have been fast-tracked.
Thank you, Amy. That's 3 minutes. Thank you
you
very much for your comments. Latoya Green, please.
Hello, can you hear me?
Yes, we can. Go ahead.
So due to COVID-19, what we're seeing in a number of businesses as they're reopening, that they're looking at their guidelines and some of the policies that they have within their establishments. Some of the policies that they're looking at is, of course, smoking within the establishment. In our county, we have 4 organizations or businesses that have decided to reopen as being smoke-free, 3 being bars, and then, of course, we know about the Four Winds Casino. Our hope is that these particular policies will be permanent with this. We're in support of the fact that they are having these policies because of the fact of, we know that it can help and reduce the spread of this particular virus. Of course, with blowing out cigarette smoke, that means that you could be blowing out the virus definitely further than the 6 feet, which is recommended for us to be apart. That's also putting the risk of workers as well as customers within those establishments. So my hope would be is that with the Department of Health to be able to support either a resolution encouraging more businesses to go smoke-free, or even supporting the smoke-free air ordinance for St. Joseph County. Just as a reminder that the Indiana state law has many exemptions, which includes the bars, tobacco retailers, membership clubs, as well as e-cigarettes. And so just want to be able to provide that support, and just to let you know that we are available, I am available to be able to meet with the board to provide any additional support or even technical support or any type of resources to help along with the support of the board. Thank you.
Thank you, Latoya, for your comments. Brandon Baumbaugh is next. You have 3 minutes. Brandon? Okay, we will move to, I believe our next person is Max. Max, you have 3 minutes. You're muted. Yep.
Sorry.
It's all right.
Rather than reiterate all the astute things everyone else said, I'll just say 3 things, and that is, well, 4 things. One is nobody's going to follow this. Second, in 2014 and 15, if you look at the CDC data, 205,077 people died from P&I, from pneumonia and flu. We didn't have people off of work. There wasn't social distancing. There wasn't quarantining. Unless I'm mistaken, that's more than double the number we have now. And the number we have now are people who die with COVID, not necessarily from COVID. The next point is people who compound medication know that when they use Wattman filters, they use 0.22 micron Wattman filters. It filters out bacteria, but no viruses. To give you an idea of what those masks are dealing with, 100 microns is the diameter of a human hair. Those masks do nothing for viruses, virtually nothing. And the other thing is, everybody is going to be infected. Blunting the curve only protracts time. Everybody will be a carrier, will be sick, or they'll die. Unfortunately, Mother Nature is sometimes capricious, but that's the way it is. Wearing a mask, in our case, is just going to forestall the inevitable. I don't endorse wearing masks anymore at all. Thank you.
Thank you very much for your comments. And then finally, John, AKA Mary Hagan. You have 3 minutes.
Yes, I apologize. I'm using my wife's iPad, and so I don't know anything about it, so I'm struggling. In any case, I don't want to appear totally anonymous. I have extensive experience in strategic planning, so I'd rather stay away from the issue of masks. But I must say it needs some clarification. One is on the part of the people who are objecting, who exactly is harmed by this order, and if you were brought suit in court, how would you prove harm? I don't think you could. But in any case, that said, I'm more interested in the strategic plan, Dr. Marker. I'm curious as to when you're going to involve the public, and the reason I ask that is because that's the important point at which they ought to be insinuated at the beginning. And I would hope you give the public a chance to look at that. Secondly, I'm mildly curious as to why you have 2 apparently different strategic plans going. Sounds a little odd, but maybe I'm missing the point here. Perhaps the board is dealing with the vision, values, goals, and as you said earlier, the larger picture to which you pass it off to the department to implement. through specific objectives that are quantifiable. I don't know why you would find quantification somewhat obnoxious, certainly not at the department level. So I'd like to be involved, and I'd like to hear how I might do that. Should I contact Heidi?
I believe so. I think that would probably be the most appropriate way.
Thank you.
Thank you for your comments. That concludes our public comments section. I would like to, invite one of my board members if you have a comment. It seems, of course, it's the elephant in the room. Everybody wants to talk about masks. And so I'm just wondering if one of our board members would like to address that issue. And then I have a concluding comment to make. And if not, we can go ahead and just move to a concluding comment. Very good. What I would like to say about this, the mask wearing, is that our Department of Health, our health officer, has the full authority of the Indiana Code to be able to establish public health emergency orders such as this. They do not take that lightly. They do their research and do their due diligence. They speak with experts, people downstate, ISDH, et cetera, et cetera. The governor himself left the door wide open for local jurisdictions to make those decisions based on what is happening in the local jurisdiction. That said, I also want to add what an amazing democratic process this all is. Here we have 25, 30, 22 people are on this call right now with diverse opinions about what's happening with mask wearing, and that we can engage in civil discourse. You brought forth research and evidence to support your point, and here we've had a discussion about it, and those things will be incorporated into the decision about how we move forward on things. So I want to say thank you to everybody for your time this evening, and we look forward to seeing everybody next month. Our meeting is adjourned.
Hey, Heidi.
Yes, Emily.
There were actually a couple of comments that were typed in. So people actually typed in some comments. I don't know if those are read, should be read in.
No, they do not. They do not need to be read in. They are copied because we are copying. This is being recorded.
Okay.
So it is part of the public record already. Thank you for bringing that up.
Sure.
Okay. We're adjourned. Bye, everybody.
Thank you.
Thank you.
You sent a note of apology to your sister. Looked like she was ready to hit into town. And what's that? Yeah. Are we still on?